Did you know that every day your body makes enough cholesterol to cover an entire elephant in a layer of fat? And while your body uses some of that cholesterol to help build and repair tissues and even aid in digestion, did you also know that this can pose a serious health risk? Today, we're uncovering the secrets of cholesterol, what it means, why it matters, and how you can take charge for a healthier life. Stick around till the end for hope-filled quotes and a power-packed call to action for you and your loved ones. Welcome back to Cure Orbit. The word cholesterol sounds scary, but let's break it down. It's made of two parts, chol, which means bile, and sterol, which refers to a type of alcohol. Cholesterol is actually a type of fat found in every cell of your body. In fact, it's such an essential part of your cells that they use it to build their outer membranes. Without cholesterol, your cells wouldn't be able to hold their shape or function properly. Cholesterol also helps your body produce hormones like vitamin D and estrogen, testosterone, and cortisol, all of which play vital roles in keeping you healthy. Finally, cholesterol plays a role in helping you digest fats. Even though cholesterol is essential for your body to work properly, having too much of certain types of cholesterol in your blood can increase your risk of developing serious health problems, which brings us to the next point. What is too much cholesterol? Well, the answer lies in understanding the different types of cholesterol in your body. There are three main types of cholesterol in your blood: low-density lipoprotein, LDL, high-density lipoprotein, HDL, and triglycerides. Let's start with LDL. Think of LDL as the bad cholesterol. That S because high levels of LDL in your bloodstream can lead to a buildup of plaque in your arteries. Plaque is made up of cholesterol, fat, calcium, and other substances that can narrow your arteries and make it harder for blood to flow through them. This buildup can cause coronary artery disease, which increases your risk of having a heart attack or a stroke. Now let's talk about HDL, the good cholesterol. Unlike LDL, high levels of HDL in your bloodstream can actually be protective against heart disease. HDL removes excess cholesterol from your blood and carries it back to your liver, where it can be turned into bile or carried by the bile out of your body. Bile also helps your body digest fats. HDL also removes fat from your cells and brings it to your liver for processing. This helps keep your arteries free of plaque and reduces your risk of developing heart disease. Last but not least, triglycerides. While they are technically a type of fat, not cholesterol, triglycerides are included in lipid panels because high levels of triglycerides in your blood can also increase your risk of developing heart disease. Triglycerides are stored in fat cells, and when your body needs energy, it breaks them down and releases them into your bloodstream. When you consume high amounts of carbohydrates and sugars, your body converts the excess into triglycerides and stores them in your fat cells. Over time, high levels of triglycerides can lead to the formation of plaque in your arteries. Now let's address the million-dollar question: where does your cholesterol come from? Well, the answer might surprise you. While some cholesterol enters your body when you consume animal products like meat, poultry, eggs, and dairy, the majority of your cholesterol comes from your own liver. Your liver produces about 75% of the cholesterol in your body. The rest comes from the food you eat. But here's the catch: your body doesn't make cholesterol when it's already in surplus. It carefully balances its production based on what it needs and what it receives from the food you eat. So if you consume enough cholesterol in your diet, your body won't produce as much. But if you don't consume enough, your liver will step up production to make sure your body has what it needs. Next, let's look at who's at risk for high cholesterol. Well, it turns out that anyone can develop high cholesterol regardless of their lifestyle or diet. However, some factors can increase your risk. For example, if you have a family history of high cholesterol or heart disease, you may be more likely to develop high cholesterol yourself. Certain conditions like diabetes, kidney disease, liver disease, hypothyroidism, and obesity can also contribute to high cholesterol levels. Additionally, if you smoke, drink alcohol excessively, or consume a diet high in saturated and trans fats, you may be putting yourself at risk. Remember, your blood transports cholesterol in special packages called lipoproteins. Two common types of lipoproteins are low-density lipoproteins, LDL, and high-density lipoproteins, HDL. LDL particles carry cholesterol from your liver to the rest of your body. The size of an LDL particle influences how easily it can penetrate the walls of your blood vessels. Smaller LDL particles can squeeze between endothelial cells and enter the walls of your arteries, triggering inflammation and plaque buildup. Larger LDL particles can't do this, so they tend to stay in your bloodstream. Unfortunately, the human body doesn't distinguish between large and small LDL particles, so your total LDL cholesterol level doesn't tell the whole story. Research suggests that smaller LDL particles are more dangerous than larger ones. However, current lipid tests measure total cholesterol levels rather than the size of the LDL particles. Scientists are working on new tests to accurately measure the number of small LDL particles in your blood. Currently, your doctor may assess your risk for heart disease by calculating your cardiovascular risk score, which considers factors like age, sex, blood pressure, smoking status, and blood sugar levels, among others. Next, let's explore how doctors diagnose high cholesterol. Doctors diagnose high cholesterol through a simple blood test called a lipid panel or a complete lipid profile. This test measures several components of your blood lipids, including total cholesterol, LDL cholesterol, HDL cholesterol, and triglycerides. Here are the general guidelines for interpreting your lipid test results. Total cholesterol. Normal levels are less than 200 mg per deciliter milligram DL. LDL cholesterol. Normal levels are less than 100 mg DL. HDL cholesterol. Normal levels are 60 mg DL or higher. Triglycerides. Normal levels are less than 150 mg DL. If your test results show that you have high cholesterol, your doctor may recommend lifestyle changes or medications to help lower your levels. When it comes to managing high cholesterol, lifestyle changes are always the first line of defense. Here are some of the best ways to lower your cholesterol levels naturally. 1. Eat a balanced diet rich in fruits, vegetables, whole grains, and lean protein sources. Limit your intake of saturated and trans fats, which are commonly found in processed foods, fried foods, and full-fat dairy products. Replace full-fat items with low-fat or fat-free alternatives and cook with unsaturated oils like olive oil, canola oil, or avocado oil. Choose lean protein sources such as chicken breast, fish, tofu, and beans instead of red meat and processed meats. 2. Increase your intake of soluble fiber, which can help lower your cholesterol levels. Good sources of soluble fiber include oats, beans, apples, and pears. 3. Consume foods rich in omega-3 fatty acids such as salmon, walnuts, and flaxseed. Omega-3 South can help raise HDL cholesterol levels and lower triglycerides. 4. Consider incorporating plant sterols and stanols into your diet. These compounds are found in certain juices, nuts, and legumes and have been shown to lower cholesterol levels. 5. Stay active. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Exercise can help lower LDL cholesterol and raise HDL cholesterol levels. 6. Maintain a healthy weight. Even a small amount of weight loss can help improve your cholesterol levels. 7. Quit smoking and limit alcohol consumption. Both smoking and alcohol can raise your cholesterol levels and increase your risk of heart disease. For those who need a little extra help, there are several medications available to lower cholesterol levels. Statins are the most commonly prescribed drugs for this purpose. They work by blocking the production of cholesterol in the liver, which can help lower both total and LDL cholesterol levels. Other medications such as ezetimibe, bile acid resins, and PCSK9 inhibitors are also available. It is important to note that lifestyle changes can be just as effective as medication in lowering cholesterol levels. So before starting any new medication, it's worth trying to make changes to your diet and exercise habits. Remember, it's never too early or too late to prioritize your heart health. By understanding your cholesterol levels and taking steps to manage them, you can reduce your risk of heart disease and stroke and enjoy a healthier life for years to come. As always, consult with your healthcare provider before making any significant changes to your diet or exercise routine or before starting any new supplements or medications. And remember, knowledge is power. The more you understand about your cholesterol levels and the factors that influence them, the better equipped you'll be to make positive changes and protect your heart health. Stay informed, stay proactive, and stay hopeful in your journey towards a healthier, happier you.